Hi, my name is Stacy Bard, and I'm going to be presenting Spicing Up Nursing Handoff, Improving Communication for Hospitalized Elders. This is an evidence-based improvement project for the ACE unit at Greenwich Hospital. The purpose of this evidence-based improvement project is to utilize the SPICES communication tool during handoff. The Fulmer SPICES tool is a highly specialized tool that can be used for communication on the acute care of the elderly unit. The acute care of the elderly unit focuses on the care of older adults 65 and older who are the most vulnerable to adverse outcomes during their hospital stay. So improving communication can ultimately lead to improved outcomes, improved patient satisfaction, as well as staff satisfaction. Hospitalized older adults are at the highest risk for common problems during hospital stays, such as immobility, malnutrition, dehydration, alterations in cognition, skin breakdown, or incontinence. This can lead to increased length of stay, deconditioning, pneumonia, pain, falls, delirium, depression, and even pressure injuries. Good communication is the key to preventing adverse outcomes in high-risk populations. Omission of vital information, especially during handoff, can ultimately lead to medication errors, lack of consistency in care, adverse events during the hospital stay, increased length of stay, as well as poor transitions. The Agency for Healthcare Research and Quality identifies that improving handoff is a national priority. They also recognize that 2/3 of all sentinel events in the hospital are a result of poor handoffs. And the Joint Commission has made it a national safety goal to improve ineffective communication, which they feel can lead to medical errors. The Sentinel Alert in 2017 recognizes that there are several barriers to high quality communication during handoff. The Joint Commission has identified the following barriers: that it can be very time consuming, there can often be many interruptions or distractions, there can also be miscommunication between the sender and the receiver, there often is no standardized method for giving handoff, there can be staffing issues, and finally, there can also be misleading information. The nursing theory that is the foundation for the evidence-based improvement project is Boykin and Schoenhofer's nurses as caring theory. It focuses on the humanness of persons and being whole in the moment. The nurse focuses on caring moment to moment with the patient and their participation as it relates to their personhood within the nursing relationship. The patient is the recipient of care each moment, and the nurse responds to the patient's individual needs. They also felt that the person deserves to be known, and the nurse must be able to commit to care for this patient no matter the circumstances. According to the Agency for Healthcare Research and Quality, knowing that a patient is at risk is only half the battle. It is essential that you act upon the risk factors and maintain the patient's safety. The focus should always be on prevention, not necessarily intervention alone. The use of multiple assessment tools helps to look at all aspects of care planning. The SPICES tool is a comprehensive communication tool that covers many different aspects of risk. It can easily be used to prompt transfer of specific information as well as further discussion regarding patient risk factors. It has been extensively studied for reliability and validity, and it can be used in interdisciplinary teams as well to individualize care planning. The goal is patient-centered care to meet each individual needs. The ACE unit model is based on the niche framework, which was developed by Terry Fulmer, who also developed the SPICES communication tool. It focuses on a holistic approach to caring for the elderly. All aspects of patients need to be assessed. Care plans should not be a one-size-fits-all base. They should be patient-centered again. And for example, if a patient has a respiratory issue and they need to sit with the head of the bed at 30 degrees or more for improved respiration, but they also have a sacral pressure injury, it is essential that an interdisciplinary approach help to minimize further injury. So communication is the key to success. Seeing the bigger picture is not an easy task. It takes skill and time. This sometimes is a barrier to successful prevention. Some of the common risk factors identified through the use of the Smaller Spices tool often have common interventions applied to them. Patients who have sleeping problems such as insomnia, reverse wake cycle, are often given options of Haldol or Ambien to help aid in sleep, but these can have adverse effects in older populations. Next, we look at problems with eating or feeding, such as dysphagia, aspiration, malnutrition, or even dehydration. Oftentimes, these patients who are high risk are given the option of Cortrax, PEG tubes. They may have prolonged periods of nothing by mouth, or they may be given too much IV fluid. This can pose significant problems in this population. Next, we look at incontinence. Oftentimes, incontinence is treated with things such as Foley catheters or straight caths. They may be diapered for prolonged periods of time, posing a risk for skin breakdown. And there are also things such as condom catheters, and all of these things can also pose a risk for infection. Next, we look at cognitive problems such as delirium, altered mental status, and confusion. These could lead to the use of Haldol, Ativan, or even soft restraints such as mids. Evidence of falls could be history of falls, which could prolong patients' ability to get up out of bed for fear of patient falling again. And also patients may be delayed in mobility waiting for physical therapy evaluations, which is actually going to prolong their mobility and cause deconditioning. Next, we look at skin problems. Patients who are high risk may either have skin breakdown or they might be at risk for having further skin breakdown, such as pressure injuries, skin tears, friction, and shear or moisture. And this could ultimately lead to overuse of wound consults. They may have to now have wound care and dressings applied. So we want to try to avoid that. Applying evidence-based interventions can help prevent functional decline in hospitalized older adults. First, we look at sleeping problems. Good sleep hygiene is essential for a good night's sleep, and maintaining a normal sleep-wake cycle is also important to minimize their confusion and also to minimize the use of benzodiazepines. Next, we look at problems with eating or feeding. It's essential to help patients who need assist with feeding to help monitor and maintain their nutritional status, as well as monitoring their swallowing and prevent aspiration. We also want to make sure that patients have their dentures and make sure they have good mouth care. Nutritional assessment should be assessed on a regular basis, and also patients need to have adequate hydration. Next, we look at incontinence. Placing patients on a toileting schedule will help promote the patients at the highest level of functioning. It will also help avoid catheters. We also need to look at putting patients on a normal bowel regimen to help prevent constipation, which could also lead to urinary incontinence or urinary retention. Next, we look at alterations in cognition or confusion. Understanding patients' baseline cognition is essential. We can also help by preventing delirium in these patients by frequently orientating them, and also use of the CAM assessment will help us understand patients who are at risk or are experiencing delirium. And promoting independence with ADLs will help minimize confusion as well. Next, we look at evidence of falls. Frequent mobilization is important, and we also need to identify risk factors in patients who may be at high risk for falls, and taking all the necessary safety precautions to prevent any injuries or any falls. Next, we also need to look at proper devices for safe mobilization and transfers to help mobilize patients at their highest level of functioning and to minimize decline. And lastly, we look at skin problems. If we identify the risk factors, then we are able to help prevent any decline during hospitalization, and frequent skin assessment is important. Also, we want to prevent patients from requiring wound care or any wound interventions during hospitalization, and we want to try to maintain intact skin by promoting or any further injury by promoting mobility, nutrition, and hydration. Here we look at a case scenario using the SPICES communication tool to transfer vital information during handoff. The nurses enter the room of Mrs. R, address her, and say good morning. The night nurse states how Mrs. R is alert and oriented, no signs of confusion, and states she slept well, but she did get up a couple times to use the bathroom, which is not unusual for her. The nurse notes Mrs. R has no problems with eating, swallowing, or chewing, and took her medications with applesauce. She says she tolerated her dysphagia diet yesterday, noting she took in 75% of her lunch and dinner. The nurse knows that Mrs. R does not have any bowel or bladder incontinence. However, this morning notices she has urinated in the bed, which is very unusual. The nurse and the CNA helped the patient sit in the chair as the bed linens were changed. Mrs. R appears to be in pain when trying to stand. The nurse immediately assessed her left hip for pain. She remembers that the patient fell when she was on her way to the bathroom at home and reported this to the doctor for further evaluation. The night nurse notes that she has no skin issues, but she has very dry skin and was dehydrated on admission. Here is a copy of the Spices Quick Guide to prompt discussions during handoff and to individualized care. Thank you so much for taking the time to listen to this discussion regarding the Fulmer Spices communication tool for nursing handoff.